Central City Concern really is a national model. It's influenced us at the National Alliance to End Homelessness and how we think about what to do. It's influenced our thinking about how you combine services and housing and employment, both from the perspective of practice, how you address the whole person with those services, but also in the systems sense, about how you finance those, how you combine them in a programmatic way, how you partner with others to get there. I think people like to attach themselves to problems that can be solved and to do something about solving problems, not just addressing them continually. Central City Concern is an organization that ends homelessness for some very high-need people. It's a very solution-oriented organization. It's very holistic in that it provides housing, healthcare, employment, and other kinds of services. It provides a lot of choice. There's not one-size-fits-all solution.
For us, getting somebody into housing is really just our first step. What we're really trying to do is to connect them to income, connect them to employment, and move them out into the community. Ultimately, I'd like the same thing for our residents that I'd like for my family. I like our residents to be secure in their finances, their health, and their home. I like them to be proud of who they are and what they've been able to accomplish. And I like them to be able to contribute positively to both their families and the community.
The agency really sticks with people. So if one thing doesn't work, you're working with them to find another model that does work. And this was actually something I feel like I learned from visiting Central City Concern that's influenced the way we think about things around the country.
There's no wrong door to housing. So we have everything from housing first all the way to alcohol and drug-free housing to permanent housing options.
There's a lot of data now that shows that housing is healthcare. It's certainly a necessary platform for health and well-being. I think we know that. The treatment services just don't work if people don't have stability in housing.
To build supportive relationships to help you with healthy habits. Those are hard enough to do under ideal circumstances. How people are able to do that, worrying about where they're going to sleep, whether they are personally safe or their loved ones are safe, it's unimaginable to me. Something that is shared by many of the folks who come to Old Town is that in some ways they've been traumatized, and many of them have been traumatized by the healthcare system. And so we do everything we can to try to lower those barriers.
One couldn't help but be impressed by how non-judgmental the staff at Old Town are. It's producing high quality care for a very difficult population. The LEAP project is about the primary care team identifying innovative, high-quality practices across the country, study them intensively, find out what they're doing in common, and then package that in a way that might be useful for the rest of American healthcare. We were genuinely blown away by Old Town.
In America, we define ourselves a lot by work. Work is valued, and the fact that people work is valued. Also, I do think people want meaning in their lives and want to contribute because it really enhances their feelings of self-worth and allows them to give back and be self-sufficient, which most people want to be.
We really have two kinds of pathways to employment. We have direct placements out in the community, and then we have direct employment placements within Central City Concern. One of the areas that residents can start with is our Community Volunteer Corps. Residents are partnered with staff and organizations out in the community. From the Community Volunteer Corps, people can be placed in the Downtown Clean and Safe program. They can be placed directly in employment at CCC, and they can work with the Employment Access Center to find employment opportunities out in the community.
Clean and Safe is a unique system and opportunity for people. This is a great first job to be reintegrated, and creating jobs on the broader market, but also creating opportunities for the people that are coming from this is incredibly important.
Many programs that are providing assistance to formerly homeless people do not really focus on employment, so I think that's a very key strategy.
531 jobs that we were successful in placing people into last year is a pretty tremendous accomplishment when you think about the economic environment that we are in.
I'm Dava Mills, and I'm in Human Resources with Vigor Industrial. This is Richard Stevens. He's one of our riggers. Richard was brought to a Central City Concern event where they brought in veterans to meet with an employer. I knew he'd be a good rigger.
Homelessness is not a problem that's too big to solve. What Central City Concern has done that's so important is that it's shown that it can be solved. One person at a time, building up until you're really making a huge impact in the community.